Welcome to Moments with Marianne. I'm so delighted we're spending this time here today. We have a very empowering show coming right up with special guest, Dr. Sunita Puri, and she's here today to share with us her new book, That Good Night, Life and Medicine in the 11th Hour. Dr. Puri is the medical director of the Palliative Medicine and Support Care Services at the Keck Hospital and Norris Cancer Center of the University of Southern California, where she also serves as chair of the Ethics Committee. She graduated from Yale University with a BA in anthropology and studied modern history at Oxford University as a Rhodes Scholar. She completed medical school and residency training in the internal medicine at the University of California, San Francisco, and fellowship training in hospice and palliative medicine at Stanford University. So let's welcome to the show, Dr. Sunita Puri.
Thanks so much for having me, Marianne.
What a pleasure it is to have you here and to talk about your new book, That Good Night. You have to be very excited as an author. I mean, it's getting such great reviews.
Yeah, I'm very pleased with the attention that the book is getting, and it is a book about really our mortality and how medicine can help us with making decisions that really are important ones when we're facing a serious illness. But it is also very much a story about my coming of age as a physician and learning to reconcile what I'd learned about mortality as a child from my parents with the reality of how in medicine we try to extend life at all costs.
Yeah. Well, and your book's very well written. I enjoyed reading it. And I would like for you to share with our listeners how your personal experiences shaped not just the work that you do, but also this book.
So, I was born as the daughter of immigrant parents from India, and both of my parents grew up in extreme poverty at the time where they were living in India. And I think that one thing that carried them out of the circumstances in which they lived was this belief in divinity and a very spiritual look at the world. And so I grew up with them really wanting to impart that sense of spirituality to me and my brother. And part of that was them trying to help me understand that life is impermanent and that we are given this time temporarily to make the most of our lives and to be of service to other people. And growing up with that at the time, I didn't really understand these messages. But when I went into medicine and I started to see that the tools and technologies that could be beneficial in many circumstances actually could cause a tremendous amount of suffering and pain for patients and families who were facing the very end of life, and a good conversation about that reality had not been had. So part of my personal journey as a doctor and finding my way was finding a specialty where all of my different selves could coexist. The self who had been brought up with deeply spiritual parents who had taught me about impermanence, the self who was always a writer and who loved language, and the self who entered medicine really wanting to be exactly like my mother, who's a doctor. And I think in palliative care, that was the field where all of my selves could really coexist.
Well, and so you talk about palliative care, so our listeners have a better understanding. What is that?
So palliative care is a specialized type of medical care that focuses on the physical, emotional, and spiritual suffering of patients and families facing a serious illness. And what I mean by that is we work together as a team with doctors, nurses, social workers, and spiritual care providers to address all of these domains of suffering at any point in a serious illness. So it could be that you've just gotten a diagnosis of cancer that is advanced, and you're going to get your chemotherapy and radiation and surgery, but you can also meet with a palliative care team to make sure that all of your symptoms and that your overall well-being is really well attended to as you go through that process. So it's distinct from hospice because hospice is a type of palliative care that we offer to patients who are closer to the end of life and really in the last 6 months of life.
Mm-hmm. Well, and I think it's so good that you make that difference so people really gain understanding because there's not a whole lot, other than your book. When I did a little bit of research, there's some stuff out there, but not a whole lot that really explains some of the differences and what people can expect.
Yep. There's not a whole lot of understanding of our field by not only in the general public, but even within medicine. I think the term palliative care is, to many doctors, synonymous with giving up or failing their patients. And so I wrote this book in part to really give people a first-hand account of what it is like to care for patients who are very sick and for their families, but also to dispel myths about what palliative care is and isn't, and to talk pretty frankly about how the resistance to our field can actually hurt patients who need us.
Yeah, that's so important. Well, and you talk about how basically you mentioned before how it really was bringing together, the family life, your career, all this, as a writer that would come together as one person that's being able to pursue what you're passionate about. In many ways, how did that transition work for you? Because it seems like it could have been quite a journey with that religious aspect as well, because in medicine they don't really, it's all about saving the patient at all costs.
Certainly, and I think that, for me, some of the moments of reckoning that I write about in the book are really about seeing a patient who was suffering, sometimes not from the disease, but from our treatments meant to battle the disease, if you will, and not knowing how to talk to the patient about what really mattered to them, given how visible their suffering was. And I think my lack of language and lack of training in how to talk with people caused me a lot of suffering and distress, because I would just do procedures and treatments without regard to whether they were really helping someone or whether I was doing these things simply because I was most focused on the disease rather than the whole human being. And so I think going back to seeing people as whole people, not just a list of diagnoses that I had to treat at all costs, part of going back to that view on human beings and patients meant going back to the language, the very humanistic, spiritual language that I'd been given as a child, and starting to learn to be brave and to learn how to ask people what really mattered to them and helping them to contend with their mortality, which is something that defines being human in a way, that we are impermanent and we are given this time to make the most of our lives, but inevitably we are not immortal.
Yeah, and eventually we all will cross that road. When you're having these discussions with patients, what does it sound like? Because I think you're right. A lot of people, they have no idea what type of language to use. And so sometimes they just say nothing.
Yes. And when I start these discussions, I always ask patients first what they know about their illness, because it's pretty interesting how often patients will tell me something. They'll say, for example, that they're widely metastatic cancer, that they're doing chemo to get cured. And in the vast majority of metastatic cancers, we cannot cure them. So they will have that understanding of their illness that is not the reality. And I start there to help bring them up to speed with what really is going on, because I would say in the majority of the situations I find myself in, either their other doctors have not communicated clearly what is going on, or maybe they have and the patient and family have heard something else. And so kind of getting everybody on the same page about the reality of the illness is the first. It's really the first, and it's often a big task. From there, I try to probe how people have been living with the reality of their illness and to ask them about their suffering in all its different forms, their symptoms, the things in their life that they can or cannot do because of the illness or because of the treatment, the conversations they've been having as a family about what they would want if this next treatment does not do for them what they're hoping it will do, and trying to really get some clarity about what they're hoping for. Many of my patients will say to me, I'm a fighter and I want everything done. And I have to take those words and be a linguist and ask them exactly what they mean and what they're envisioning when they say they want everything done. And sometimes it means being very brave and telling them that we are doing everything, but your body is still dying. And really not be afraid to go there in a kind and compassionate way.
When you do that, do you feel that more people are open to hearing what you say and not really shutting down?
I think it depends on the circumstance. Sometimes, unfortunately, again, because palliative care is thought of as the team you call when you're giving up, I think many of us in the field are asked to meet with patients and families towards the very end when the stakes are high and emotions are running high as well. So sometimes even the most compassionate, kind conversation, it can be hard for people to hear from a stranger. But when I've gotten the opportunity to get to know people over time, in my clinic and then in the hospital when their disease gets worse, I think that having familiarity with me really helps them to be open and to have an honest conversation and to understand that although these topics are really difficult, they're also essential to discuss so that we can spare them unnecessary suffering and certainly spare their families unnecessary suffering.
What is one of the most common things that you hear people tell you, as they go through this process?
So I hear a lot of things pretty frequently. I think one of the most common things was something that I'd said earlier, which is people framing themselves as fighters and saying that they want everything done. And I think that, obviously the prospect of death or living with a serious illness provokes fear and anxiety. And I think people often they feel as though they have to fight and do everything possible to overcome a disease, when in fact it's really at a certain point not about them, it's about the limits of their body and the fact that nature will always win over medicine. And so helping them to come to some level of understanding about that is something that I have to do pretty frequently. I also have people ask me what dying feels like, whether they will suffer, how I will take care of them, what it might be like for their families. They'll tell me that they hope that they can stay alive to see someone graduate from high school or somebody get married. And we talk about those goals pretty openly so that I can help them make choices about their medical plans that will help them get to those goals if possible.
I think that's probably really encouraging for some people when they look at end-of-life care, that it's not just they're someplace and they're going through the dying process. I think it looks very different than what a lot of people, think. I mean, we've got the Hollywood version, and then we have the real version where people can go on, they can make plans depending on the situation and kind of move forward from that.
Absolutely. And I think something that people forget, and I think, again, maybe the media and film portrayals have a lot to do with this, people think of dying as lying in a bed and waiting for the end to come. And actually, many of my patients who we treat very well are still very much living, although their bodies are failing them. And that is ultimately the goal, to help them live the best, fullest lives possible, as comfortably as possible with minimal suffering, no matter how much time they may or may not have. And that is something that I wish I saw portrayed better, because I do have a lot of patients coming to me saying that this is their image of death and that it comes from film and TV and fairly inaccurate representations of what dying as a process actually looks like. And I think that if those portrayals were to change, perhaps we as a society could advance our understanding that dying is not only a part of life, but that it can be a very sacred time that is just as full of life as other years in our lives are.
Well, it would seem that you are bringing in some of your great spirituality from your family with that point of view, and I think it's something that a lot of people can embrace, because if we look at it from that perspective with those lens, it is a very spiritual, part of a great life.
It truly is. I remember a mentor of mine telling me in my training that part of living a good life is dying a peaceful death. And I think, that is something that we as a society have a very hard time thinking about and planning for. And it's very understandable because of all the fear and anxiety that we've yoked to our mortality and to the idea of death. Death is an unknown. We don't know what it's going to feel like. We don't know what might or might not await us after that. We don't want to leave the people we love. And those are all very human perspectives on the end of life. But I think what's interesting is that ancient civilizations, much less advanced than ours now, they had a way of thinking about mortality and revering it that we seem to have lost. And I find that really interesting, that we can be very technologically advanced and advanced in other ways, but we may have forgotten some very essential things about what it means to live a human life. And part of that is understanding, revering, and even, preparing for our mortality.
Do you find that your book, That Good Night, is really helping, people in the medical field and educators to position the discussion about the end of life in a very different way?
The feedback I've gotten is that many people, and the best part of writing a book is hearing from readers, and a number of people in palliative care, but also outside of palliative care, and readers who are not in medicine have all written to me and told me how much the book has meant in terms of its beautiful storytelling, and through that, in a very inviting way, helping them to understand and to question their misconceptions about mortality, palliative care, and the role of medicine in helping them to live and die well. So one of the reasons that I wrote the book was to do exactly that, was to write a gorgeous narrative that really helps bring readers into the humanity and the vulnerability of both doctors and patients who are facing these really high-stakes issues. And my hope in the longer term is that the book does change the conversation by giving people language to use to have these discussions.
I think it would be just an amazing thing to start seeing some of this education in med school, as part of some of the training that's done, and I know they do some, but not to this degree.
Definitely not. And it is also my hope that the training for doctors, nurses, social workers, everyone involved in the care of patients will evolve to include exposure to palliative care and hospice very early on, and a curriculum to really help empower future doctors and patients about how to talk about these issues. Because I think the most difficult circumstances in many of our training is the times when we don't know how to tell someone something really difficult. Those are the cases that have kept me up at night. It's not the cases where I think to myself, I could have done this or that differently. It's really the situations where I am doing something to a patient because I can and not because I should, because I didn't have the language to really tell them otherwise.
Well, and it kind of has me thinking, so if you are dealing, let's say, with a family who's making a decision for a child, how has the discussion changed with that? How's that different?
So I do see quite a number of parents making decisions for their adult children. I don't really work very much in the pediatric world, so I can't really speak to that. But I can say that when adult parents are faced with making decisions for, their 30, 35-year-old, that part of what I have to help them see is that although this is not the natural order of things, their child may be 35, but the body's physiology is that of someone who's 85, because the cancer or the heart failure or whatever type of devastation has made the body function very poorly. And trying to help them, trying to be as empathic and compassionate as I can about the fact that they may be losing their child, but also helping them to see that there may be a way of compassion and least suffering that we need to talk about. And I think helping them to see the difference between the child's age and the function of the body is generally where I find some success. But, there's nothing anyone can ever say to make that sort of devastation easier.
It seems that when you make the distinction between the body and the person going through, their end-of-life process, that, just how you mentioned that, it makes it seem like it's an easier discussion for people to really kind of process.
Yes, I think that separation is an essential part of some of my more difficult conversations because, we are who we are and we need our bodies to be who we are. But the body is fundamentally, in a lot of ways, separate from who we are. And I think that helping people to understand that a body has a limit and that medicine has limits, that's something, again, we don't really talk about when we use terms like I'm a fighter and I want everything done. I think that language is extremely limiting to having a real discussion about a serious illness, the reality of living with it, and what someone wants for themselves, and helping them to see that it's not their fault if their body has reached its limit. It doesn't mean that they haven't fought hard enough when the body reaches a limit. It's simply trying to get them to accept and understand that the home they live in this world, this bodily home, has limits of its own that are really ruled by the laws of nature. And medicine can only push those limits so much. And it really does help people to feel, and families to understand, that we cannot push the body past its limits.
Yeah, there is a limit to that. We all come with our own expiration date, and the body do what the body's going to do. Not a whole lot. And granted, we've got some amazing doctors that really do some fabulous work in helping people have, such as yourself, helping people have as long as a healthy life as possible. And people, like hitting that anniversary or that wedding or whatever that is, I just applaud you.
Thank you. I find a lot of meaning in this work. A lot of people, including my own parents, as I write about in the book, have wondered why anyone would want to do this. But I very much believe that part of being a good doctor is walking people through that last part of the journey, being open to being with their suffering, and helping them to find ways to cope that will maximize their wellness and give them the best quality of life possible. It's very meaningful.
We need more great people like you doing that, because I've had friends that have had untimely passings, but it's their body can only take so much, and so it's having somebody that is there to be able to explain things and to have these conversations, I think, is immensely invaluable. Dr. Puri, where can people connect with you and learn more about your book, That Good Night?
So people can connect with me through my website, which is my first name, Sunita, Sunita, and my last name, Puri.com. And a simple Google search for my name or the name of the book, That Good Night, will bring up my tour dates for the book and certainly Amazon and other bookseller links to buy the book.
All the places they can connect with you. Well, Dr. Puri, thank you so much for taking the time to be on the show with us here today.
Thank you, Marianne. It's been really, really wonderful.
Well, thank you, Dr. Puri. It's been such a pleasure to spend this time with you and to talk about your new book, That Good Night. Again, if you'd like to connect with Dr. Puri, you can at her website, sunitapuri.com, and we'll have the link below. That Good Night is available at Amazon, Barnes & Noble, and all indie bookstores. Well, we're at the end of our time today. I would like to thank everyone for tuning in. You're listening to Moments with Marianne. And remember, make every moment count.
In a single moment, your life can change. Moments with Marianne is a transformative hour that covers an endless array of topics with the best of the best. Her guests are leaders in their fields, ranging from inspirational authors, top industry leaders, and business and spiritual entrepreneurs. Each guest is gifted and a true visionary, a recognized leader in her own work, and while teaching others to develop, refocus, and grow, Marianne will bring the best guest and sometimes a special surprise. Don't miss this. You never know just which moment will change your life forever. Moments with Marianne airs every Sunday, Monday, Thursday, and Friday at 8 p.m. Eastern and 5 p.m. Pacific Time. Make sure to tune in and visit momentswithmarianne.com for more information.